Greetings to one and all present here. I am Neha and I welcome you all to the today's webinar on the behalf of Pediatrics Limited. We are very much delighted to have you all with us today for this engaging session. Before we begin, I would like to give a brief intro about our moderator, Dr. Amit Luthra. Dr. Amit Luthra is a well-renowned dermatologist and aesthetic physician based in Delhi, and he has completed his MBBS and DNB in dermatology venerology from the prestigious institute AFMC Pune and has over 2 decades of experience. He is the founder and director of Ishira Skin Clinic, Delhi, and he is the respected member of national and international associations such as IADVEL, CDSI, and EADV. Thank you so much, sir, for joining us today.
Thank you so much for having me here.
You
can start.
This webinar also features an eminent panel of experts, and I would like to take a moment to briefly introduce them. So I would like to share my screen first.
Yeah. Mr. Bruno, can you allow a screen to share, please?
Hello?
Yeah.
Hello?
Please.
Hi, Bruno.
Good morning. Good morning.
Good morning.
Good
Please
morning.
allow
Yes,
Neha's
good
screen
morning.
to share.
How are
Yeah.
you? How's everything? Can you
Sir.
see my screen that is in condivision?
Sir, the webinar has already started. Your screen is, we can see your screen. But
Yes.
before that, we are going for the introduction of the panelists.
Okay,
so
perfect.
please allow screen to share, Neha's screen to share. Yeah. Please allow Neha's screen to share for introduction of panelists.
Yes. So I have to remove the condivision, right?
Yes.
Yes, now I am able to share my screen.
Yeah, please.
Is my screen visible to all of you? Please confirm.
Yes, Neha,
Yes.
please go ahead.
Okay. So firstly, we are having Dr. Indu Balani from Delhi. Ma'am is a dermatologist with over 20 years of experience with many awards and recognition to her name. She is graduated from GSVM Medical College, Kanpur in 2001 with multiple gold medals in her MBBS. She completed her MD in dermatology, venerology, and leprosy from Alpes Institute of Cardiology. Next, we have Dr. Ankur Sareen. He is a skilled dermatologist and hair transplant surgeon trained under the world-renowned hair transplant experts in Tehran, Iran. He holds an MBBS and an MD degree in dermatology, venerology, and leprosy, along with an MRCP SCE from the United Kingdom. Sir has further honed his expertise by completing a fellowship in cosmetic and laser surgery from Ludwig Maximilian University, Munich, Germany. Next, we have Dr. Supriya Desmukh based in Mumbai with over 16 years of experience. Ma'am has completed her MBBS from Grant Medical College and Sir JJ Hospital, Mumbai in 2003 and MD in dermatology from Dr. D.Y. Patil Medical College and Hospital, Navi Mumbai in 2009. Next, we have Dr. Usha Beloskar. Ma'am has completed her MBBS from KEM Hospital, Mumbai in 1996 and her post-graduation in skin and venereal disease from LTMMC Sion Hospital, Mumbai in 1999 and is one of the best dermatologists in Mumbai. And ma'am brings over the experience of 24 years in the field. Next, we have Dr. G. Jyotsna. Ma'am is a dermatologist with over 19 years of experience and completed her MBBS in 1988 and holds a diploma in dermatology from Kakatiya Medical College, Warangal in 2003. And she is also a member of Indian Medical Association and CDSI. Next, we have Dr. Padmavati. Dr. Padmavati Surapanini is a renowned dermatologist and cosmetologist in Hyderabad. She has completed her MBBS and MD in dermatology, venerology, and leprosy. She is the founder of Pragna Skincare and Laser Clinic in Hyderabad, and her expertise includes laser dermatology, aesthetic procedures, and skincare. Next, we have Dr. Minaz Khoja. Ma'am is a dermatologist, cosmetologist, and venerologist based in Pune and holds an MBBS degree and was awarded a gold medal in her diploma in dermatology. She actively engages in teaching training, and mentoring the fellow professionals through workshops and conferences. And she is also the founder of Dr. Mina's Khoza Skin, Hair, and Laser Clinic in Pune. Next, we have Dr. Roma Pandey. Ma'am is a renowned dermatologist and cosmetologist based in Chandigarh with over 28 years of experience in dermatology and aesthetic medicine. She holds an MBBS from Rajiv Gandhi University of Health Sciences, Bangalore, and an MD in dermatology from Jawaharlal Nehru Medical College, Belgaum. Last but not the least, we have Dr. Sanjit Talwar, and he's a dermatologist, cosmetologist, and dermatosurgeon with over 12 years of experience in clinical and aesthetic dermatology. He completed his MBBS and MD in dermatology, venerology, and leprosy in 2012 and went on to pursue a fellowship in aesthetic medicine from University of Greifswald, Germany in 2014.
Yeah, thank you, Nia. Now,
yes, and
yeah.
I would also like to thank you all for joining us today. And I'm really sure that this session is going to be really insightful for all of us. And without any kind of further delay, I would like to hand over this session to Mr. Prashant Agarwal, which is Head of Marketing, to present a brief PPT about the Beta Drugs Limited. Over to you, sir.
Thank you very much. I will not take much of the time, and I will just give a quick brief about the company, because it is very important to know about the company. We are from Beta Drugs Limited. The head office is in Panchkula, and just a minute. Yes, the head office is in Panchkula. It is one of the fastest growing pharma company in India. It has been growing with the CAGR of 35%, and the growth is multiple times better than the industry growth. If you see, in 2020, the share price was around rupees 100, but in 2025 it has touched the price of 2,200 rupees. So that kind of growth this company is having, and this is because of the company's strategic vision, operational excellence, and customer-centric approach. Our guiding principle is the patient first approach. We focus on patient compliance. We focus on patient support, patient education, and the cost effective medicine. Beta Drugs is a prominent player in Indian oncology and the cosmetology market. It is the most trusted manufacturer in cytotoxic segment since last 15 years. The company is manufacturer of the widest range of branded oncology drugs. And not only this, company is also backwardly integrated with the manufacture of API. Company is having presence in more than 46 countries across the globe, and it is known for its stringent quality and regulatory parameters. Company focuses on strong R&D and intensively working on targeted therapies and NDDS formulation. In oncology, company is having the leadership position in the market, and the products are available in major corporate and the government institutions. In cosmeceutical market, we are having pan-India presence with more than 6,000 customer reach, and day by day we are increase our prescriber base. Not only this, we are expanding our portfolio, and we have done the agreement with the European company for the first to launch products in Indian cosmeceutical market. These are some of the products are part of our current portfolio, like Recapro, Advil, Lathrix, Uvirex, Briface Serum, and New Palace. Now we are making inroad in high-end cosmeceutical market with the collaboration with MNCs like Promo Italia and the Fresidum. Recently, we have launched Skinfill Derma fillers from Promo Italia. We are expanding in international market, and we are having currently we are having presence in more than 46 countries. With international accreditations, we are making inroads in different companies. As I said, we are having diversified portfolio in formulations, CDMO, and API manufacturing. We are preferred partner for many Indian pharma companies like Glenmark, Cadila, RPG, Torrent, Intas, Alchem, and many more. The company has been awarded consecutively 3 years by the Forbes, and it has been recognized as a top 10 pharma manufacturing company in India. And this is the testament of our strategic vision, financial strength, and operational excellence. Thank you. Thank you very much. Once again, I welcome our speaker, moderator, Dr. Luthra, and panelists, and all our participants. Thank you very much. Now I hand over the session to Dr. Luthra. Sir. Sir, please, I am handing over session to you, sir.
Thank you, Mr. Agarwal, for that introduction about beta drugs. It's actually a great pleasure to have everybody here. And we have a wonderful speaker with us, Dr. Pascal Ruggiero. I hope I got his name right. He's a cosmetic surgeon from Italy, and we have got lovely panelists from India. 10 of us are here. And Dr. Ruggiero, a quick word about him. He's completed his medical education and advanced training in aesthetic medicine from the International School of Aesthetic Medicine in Rome, and he's been practicing since 2013 October, so 12 years of experience. And he runs his clinic called Sculptura Cosmetic and Plastic Surgery in Naples, and he's been practicing there for the last 5 years at this particular clinic. And his understanding of the Skinfill range will guide us through the understanding. I understand it's a new filler. It has 3 variants, silver, gold, and diamond, if I got it right. So the market in India is actually exploding, and it would be lovely to have a new filler which is backed by science from Italy. So I hand over the mic to Dr. Pascal Ruggiero for his lecture. Post his lecture, we'll have a little discussion. So if people have questions, they can put it in the chat box. I'll take up those questions at the end, take the help of the panelists, take the help of Dr. Pascal, and then we can come to a conclusion. Over to you, Dr. Pascal.
Hello, good morning to everyone. Yes, I'm Pasquale Ruggiero, but it's okay. It's perfect your pronunciation. I think I could be with this new name in your country. It will be a pleasure for that. Anyway, I'm here just to talk with you, to share my experience about our product as Promo Italia, I mean. And the idea is to share my screen just to allow you to see the presentation. I don't know if you can see my screen.
Yeah, we can see your screen, Dr. Pascal.
Okay, great. So the idea is to speak about our dermal filler line, so Skinfill Plus, and we are going to see our collection, our filler collection. We already know what are fillers because I saw that a lot of doctors are dermatologists, so they have already experience about that. And anyway, nothing to say about what are filler. We already know that this line of products is made with hyaluronic acid cross-linked, but we will see all together. That's the line. So we are able to speak about 3 different products because of the difference in terms of not only percentage of hyaluronic acid, but also about the percentage of cross-linking agent. We know that on market there are a lot of variety of hyaluronic acid-based product with different degrees of cross-linking. In this context, is essential to provide clear and reliable information. So with this purpose, we would like to introduce the unique features of the Skinfill Plus range by presenting the specific rheological and clinical properties of each product. The growing number of hyaluronic acid-based filler available on market makes it increasingly important to guide physicians in choosing the most appropriate product for each clinical indication. Of course, we already know that there are specific products designed to ensure efficacy, safety, and versatility, thanks to its carefully calibrated rheological properties. The idea is to choose the right filler for the right area with the less side effect or without side effect in our clinical practice. Of course, We will go to speak about the concentration of hyaluronic acid that can make the difference. As I said, also the degree of cross-linking, in this case, BDDA, the rheological profile, so elastic modulus, G prime, viscosity, cohesivity, and particle size and distribution. These parameters determine the lifting capacity, tissue integration, resistance to mechanical stress, and duration of the clinical effects. Going deeper into the rheological parameters, we are able to speak about more than one thing, because we know that rheological parameters are fundamental for understanding the clinical behavior of dermal fillers. First of all, the elastic modulus, or G prime, also known as a storage modulus, that measures the resistance of a gel to elastic deformation. It represents the amount of energy that the material can store when subjected to stress. Clinically, when we speak about G prime, we can understand that we indicate the greater lifting capacity and projection. So fillers that have a high G prime are able to be used also to make great volumization, great contouring effect, and providing structural support. When we speak about the viscous modulus, so the G second or loss modulus, reflects. We are speaking about a parameter that reflects the viscous component of the filler, describing the amount of energy dissipated as flow when stress is applied. So this parameter influences the injectability, softness, and adaptability of the product, particularly relevant for dynamic facial areas. So generally, we speak about this kind of parameter when we are going to differentiate fillers that could be softer and differently than what we said before, filler that could be used in more dynamic areas. But normally, these kind of parameters are used for all fillers, of course. So there are just differences in the in this specific parameter. Sorry. Going forward, we have another parameter that could be interesting for us, the viscosity, that defines resistance of filler to flow under shear and is also directly related to the extrusion force required during the injection. So high viscosity products tend to provide stronger volumetric effect, but require greater force to injection, while low viscosity filler distribute generally more easily and are suitable for superficial planes and fine correction. Speaking about cohesivity, we are referring to the ability of the gel to remain as a single entity without fragmenting or dispersing once injected. High cohesivity ensures stability of the filler, reduces the risk of migration, and improves definition of the treated areas. Another important parameter is tan delta. The tan delta is a parameter that is a ratio between G second and G prime, which indicates the balance between viscosity and the elastic behavior. Values closer to 0 reflect a more solid-like and rigid behavior, whereas values closer to 1 suggest a more fluid-like and adaptable behavior. In general, this kind of parameter is not really close to 1, but they are almost always closer to 0. So normally we can see the more close to 0 are fillers that has this kind of effect that are able to make some kind of solid-like effect, and a little bit less close to 0 are fillers that are more fluid, like other kind of products, more liquids. And finally, the degree of cross-linking that play a key role in determining the longevity and resistance of hyaluronic acid fillers. A high degree of cross-linking increases resistance to enzymatic degradation and provides a firmer more stable gel, while lower cross-linking yields softer gel with faster reabsorption. Of course, we already know something about that. When we are going, when we are going uh, to make a focus off in these specific parameters, we can see, of course, again, just to remember that the G prime is something that can be in clinical implication interesting for us because higher lifting capacity and projection has a high G prime. So this is ideal for volumization, contouring, and structural support. When we speak about G seconds, of course, the G second is the viscosity component, energy dissipated as flow under stress, how much the gel flows when stressed, influence injectability, softness, adaptability to dynamic areas, as I say. Viscosity, when we have a high viscosity filler, we have more difficult injection, stronger volumetric effect, and lower viscosity, we have easier distribution of superficial area. When we speak about cohesivity and clinical implication, we ensure product stability, we reduce migration, improve definition of treated areas. And when we speak about tan delta, we understand that it can help to determine if the filler behave more rigidity or more softly adaptability. So about degree of cross-linking, we already say that normally it change the longevity of the filler into our bodies. Exactly as we said before, in practical examples, fillers with high G prime and high cohesivity are best for jawline, chin, cheek augmentation, or in general for deep volumization. Filler with lower G prime, they have a moderate viscosity, high spreadability, ideal for fine wrinkles, for lip contouring, for delicate periorbital or perioral correction. From a clinical perspective, fillers with a high G prime and high cohesivity are most appropriate for structural treatments or deep volumization. Conversely, fillers with lower G prime, moderate viscosity, and high spreadability are better suited for delicate areas and, of course, superficial redefinition. We can say also something about Coesix technology that is something specific for this filler line, because Coesix technology represents an innovative approach to improving the durability of hyaluronic acid. Because generally, we know that fillers has an ability to be binded by some kind of cross-linking agent, such as BDDE or DVS. This proprietary process is applied during the final stage of hyaluronic acid production, where the linear chain of hyaluronic acid are subjected to a controlled magnetic field. So the Coesys technology represents a magnetic field where the molecules are able to be binded between their cells. This induces, of course, a polarization of the chain, leading to enhanced cohesion between cross-linked hyaluronic acid molecules when then adopt a distinct three-dimensional globular configuration. The consequences of this structural modification are twofold: greater resistance to enzymatic degradation, so better than fillers that are just cross-linked with BDD. And of course, the globular structure demonstrates increased resilience to hyaluronidase activity, that we have also preservation of histological biocompatibility. So the filler retains its natural tissue integration and safety profile. In addition to the improved structural stability, Coesix optimize the fluid dynamic properties of the filler, ensuring smooth injectability and natural integration in both superficial and deep dermal layer. We can see some kind of clinical application choosing the right filler. Of course, to make structural support, nose, chin, jawline, we need some kind of fillers that have an high G prime, high cohesivity, and that are injected in deep plane generally. Periosteal or submuscular. Generally, it depends. It depends on the area about that. But normally, they are deeper. You cannot inject this kind of fillers too superficial. To make some kind of malar or cheek projection, we need a moderate to high G prime with good cohesivity for projection. To treat, for example, triad trough, we need a low G prime, low cohesivity, smooth. So we need smooth products with small amounts in deep plane. Of course, cushion with vessels, but this is important for all these kind of fillers. And for lips, for example, it depends on the volume that you want to give to your patient. Do you have low to moderate cohesivity and viscosity for softness and definition? And of course, you have to stay a little bit more superficial or subdermal plane. With fine lines or superficial wrinkles, you need a low G prime with micro helicots in superficial dermis. Thinking about anatomy, nothing to learn by me, but just to understand that we have different facial fat compartment. We already know 23, but the implication of fat compartment in some kind of areas is important because you can imagine to restore this kind of facial fat pads deeper or more superficial than they are. Something that I consider a little bit more important is about the arteries, because we know about the vascular anatomy and safety. We have an high risk arteries, facial artery, infraorbital artery, especially superior and inferior labial arteries, superficial temporal artery. That is something that often can be broken, and especially for fortunately broken. But if you are inside, you have to avoid to inject any kind of hyaluronic acid filler. Dorsal nasal branch. There are also some frequent anatomical variations, so I suggest always to aspirate and to prefer slow injection, and especially for some kind of areas using cannulas. The injection planes and indicative volume depends on what we do normally with this kind of products. Normally, we can stay supraperiostal or generally deep when we inject the nose, the chin, the jawline. And in this case, of course, it depends on which technique we use. If we are with needle, we can inject 0.1, 0.5 ml per point with an high G prime filler. In the deep cheek compartment, 0.5 or 2 ml per side, but using a moderate to high G prime fillers. Superficial subcutaneous for lips, fine lines. We can use other kind of techniques with microbiologists or tear trough, microtunneling or fanning, because especially in this area, I generally use cannulas. Here we can see something about needle and cannulas. We already know that needle is something that can help us to obtain precise bolus placement with a higher risk of vascular puncture. But of course, if you know some kind of anatomy, this could be so difficult to do. With cannula, we are less traumatic with the lower risk of bruising or occlusion. It could be helpful to obtain injection in superficial plane or and broad distribution, but it depends on the area. There are areas that need to be treated with the needle, and of course, there are areas that need us to be treated with cannula. In our catalog, we can see something about, of course, the range of Skinfill Plus. We have a philosophy, so innovation, elegance, and reliability at the service of natural beauty. The hyaluronic acid fillers combine cutting-edge technology, safety, and natural results. They are designed to respect the unique features of every face, and of course, with this specific line, we know that we have a product tailored to restore volume, to treat smooth wrinkles, and to enhance contours with harmonious and long-lasting outcome. The first product of our line is Skinfill Silver Plus. We have a concentration. Of course, here always products are cross-linked with hyaluronic acid. And this specific product is designed to treat wrinkles and superficial wrinkles and thin lines. we have a concentration of 15 milligrams per ml. Of course, hyaluronic acid is done or is obtained by biofermentation, so by bacteria, but of course highly purified. Every companies obtain this kind of hyaluronic acid in this way, but the difference, as we said, is the concentration. In this case, we have BDDE as cross-linking agent. We have one box, and inside this box, we have 2 glass vials of 1 ml of product with full needle of 30 G. Second product of the line is Skinfill Gold Plus, always cross-linked hyaluronic acid, concentration of 20 milligrams per ml, always by fermentation, BDDE cross-linking agent, but not only, because I want to remember to you that we have also the technology, the COE6 technology, box or 2 glasses of vial, 2 glass vials, sorry, of 1 ml, for needle of 27 G. So 2 needles for each vial. The concentration of the Skinfill diamond, that is the last one of our line, is 25 milligrams per ml with BDDE as cross-linking agent. Also, in this case, we have 2 glass vials of 1 ml with 2 needles per each vial in one box. The idea to compare the products just to understand the differences between the Skinfill Silver that has a G prime. I want just to show you the G prime that is 130, and in Skinfill Gold is already almost double of that because it's 267, and in Skinfill Diamond Plus we have almost the double of what is the value for Skinfill Gold Plus. So we have values that goes in the that increase going up in this kind of line. Of course, as I said, with Skinfill Silver we can treat superficial, mid-phase, or we can do mid-phase soft volumization, some kind of superficial correction. With Skinfill Gold, we can use the product to make cheek augmentation, chin projection, jawline contouring, ideally for mid and deep areas, so making some kind of deep volus. And I like it a lot to treat the lips. And Skinfill Diamond is the last product with a very high G prime, highly structural, with maximum lifting capacity that could be collocated to obtain contour definition, chin, jawline, profile enhancement, selected non-surgical rhinoplasty, and deep planes injection. About the implants technique, there can be many implants technique, of course, depending on the results that you want to achieve, and above all, on the type of patient to be treated. But of course, from Italia, talked about that, and they started to imagine how to treat this kind of patient, also with some kind of specific technique that we have here. We try to get the video to start. Just try. Okay. We divided the technique in base of the aging of the patient. This is an 8-point technique, of course, for each side to obtain a lifting effect. You can just draw these lines, and we are able to understand that we are going to inject. It's not me, this is a colleague from Milan. He talked about a new technique, but this is just a technique that enhances specific areas to obtain the best lifting effect with the less injection as possible. As you can see, there are 4 points to the upper area. And other 4 points, sorry, for the lower. At the end of this technique, you will see, of course, an effect that is done with needle. I'm going a little bit deeper. And the product is injected, showing how to treat a aged person. Generally, it depends on what you want to do. This is a new kind of technique. Sometimes there are areas where I prefer to use cannulas, but it's up to you. You know, when you have your patient, you can decide if you want to inject with needle or with cannula. This is just a suggestion to treat, you know, specific points. And here we can see the result of this technique. Here we have another video. With just 4 points for each side. Less aged. Of course, this is a middle-aged patient. If you have questions during these videos, you can ask me. So just to do something during the video, because I can comment, but you don't know. Nothing specific to say. The colleague is just identifying the areas that needs to be treated.
What product is being used, Dr. Pascal?
In the first patient is used Skinfill plus diamond. Here there is a mix of products, especially Skinfill plus gold, but also diamond, of course. It depends on the area, especially in the central area, in the medial area of the cheek. So I'm speaking about malar area. I'm speaking about tear trough. When you treat, you need products that are softer, of course. So generally, I don't treat the cheeks, and I don't treat the cheeks with needle, but as I say, this is just a suggestion.
Dr. Pascal, could you guide us through the marking that is being shown in the video?
How to make this drone? Yeah, generally you need to apply the products, or better, showing. Just let me go back. When the colleague finished to make, I'm so sorry. Okay. When the colleague finished to make this drone, it appears, you know, here, for example, for 8 points, no? So that is the most complicated draw. Normally, you apply on the hinder lines that are from the nose to the tragus and from the lateral canthus to the jawline, normally. Sorry, to the labial commissure. as you can see. Okay, just stop here. Okay, now, as you can see, there's just another line traced, starting from the lateral canthus, ocular canthus, directly down, and there is another one that is the medium papillary line that goes directly down. Apart of that, normally the other kind of lines that the colleague is drawing are generally areas where he want to treat. So normally, as you can see, he's just drawing like a triangulus on the lines that we have, and drawing in red color the areas for the chin or the cheekbones, just to inject the product. And after that, in 1 centimeter laterally, then the alar cartilage of the nose, he's drawing the point to inject the product into, the piriform fossa.
Yeah.
After that, he's drawing something for the jaw line, just for the jaw angle. Here, I think it's just an area for marionetta lines, but nothing to say about that. On the cheeks, as I said, this is just, in my opinion, is a visual point. So you cannot understand how to inject the cheeks in soft area of the cheeks in general with needle. It's something that always normally the product is spread out. So I prefer to treat the cheeks with fanning technique using cannula. And after that, the colleague is drawing something for the jaw angle, as you can see. So the same that is done for the other
So
patient.
do we really need so many lines on the face for marking?
No need all these lines. Yes, I think no. But
Yeah.
there is
Yeah.
exactly. That's what I think. Or better, when someone starts to invent something new, it's something that sometimes appear like strange, but it could be considered like a new technique. We can say that. Okay.
Yeah.
I don't agree with all drone, but it's just a new technique, new suggestion. On the second video, we have more or less the same we saw, but we have also another video, the last one, with just less points. And we will be surprised hearing have just 3 points for the middle cheek. This is a younger patient, of course. These are other kind of lines. This is okay. Now is the hinder lines, starting from the nose to the tragus, and starting from the lateral canthus to the labial commissure. Here he designed or he drawn just the area where needs to be treated, the cheekbones. The point of major or rather the higher projection for the cheekbones in the malar area. About cross-linking hyaluronic acid fillers, there's nothing to say of new. I mean, it's just something that depends on the technique that you use to apply the product. And just with these 3 points, jawline, marionetta lines, and cheekbones, you can obtain some kind of lifting effect. Something, differentiation by this technique with hyaluronic acid and the 5-point technique that we can use as Promo Italia for other products. But the idea is that for the beginners could be maybe more interesting. Anyway, here we can see some kind of clinical cases. taken by customers from Italy. This is a colleague from Egypt. Here we can see some kind of lip fillers. Again. Here again. Another colleague from South America. This is an Arabic colleague. So what you can do about, the jawline, the chin augmentation, and the jaw angle. Rhino filler, and again from Egypt again. So I have also a lot of my cases, but our scientific department prefer to use, of course, the customers' pictures. Just to know that there are a lot of colleagues that use this kind of fillers to make good jobs in general for all around the world, from all around the world. And here, just the last slide to say that this is not a brand, but this is a philosophy. So thank you for your attention. And I hope that you have some question. So you don't know, the argument can be a little bit clearer for you. So let me know.
Thank you so much, Dr. Pascal, for that wonderful presentation.
Thank
We
you.
do have some questions.
Sure.
Let me take up the question, and I can ask my fellow panelists as well to come in with their suggestions. There are 10 of us here, so it would be a great idea to kind of put in your name first when you speak so that we know who's speaking, because it becomes otherwise difficult. Question is, should lip fillers be done with cannula or needle? Because they say with a cannula, septa is broken, hence more chances of migration. Dr. Pascal, should lip fillers be done with cannula or needle?
I prefer to use just a needle on lips, applying it when possible some kind of lidocaine into the mucosa of the patient, just because there is a great colleague that is a good anatomist. He's called Sebastian Cotofana, and he demonstrates that we have into the lips different compartments. So the difference of the injection with needle and with cannula is that when you use the needle, you can also correct different areas and in the point that you need or that you think it needs to be injected. When you use the cannula, in some case, you cannot be able to inject the entire lips, especially for this problem of compartments. So normally, when you have to define the lips, and when you have to define a patient that doesn't have lips, we can say, it's better to use needle, in my opinion.
What about the other panelists, Dr. Minaz, Dr. Supriya, Dr. Hindu? Any comments on this, please?
So, Dr. Minaz here. I generally prefer the needle, like Dr. Pascal also said. But sometimes when it is like very deficient and I want to be a little more even, that's the only time I use a cannula. But it has to be a wider cannula, and it meaning for those who have lesser pain tolerance and very scared of pricks, multiple pricks. Maybe that's the only case where I use a cannula. Otherwise, essentially, it's a needle.
Okay, what about the others, Dr. Hindu?
So I also think it's a personal preference also sometimes, but yes, finer cannulas people are using. I prefer needles, although especially on the lips, although I'm a user both of cannula and needles, but prefer needles more.
Supriya, what's your opinion? Do you use a needle or a cannula?
So I only use needles. I've never really tried a cannula. I basically like the precision that comes with the needle. Because I feel in lips the migration risk is a little higher. So it sort of starts projecting outside the upper border. So I like to be precise and I like to use the needle.
Would you say, Dr. Padmavati, if you use a needle as compared to the cannula, there's more swelling after the procedure?
I think I
Padmavati,
prefer cannula. I prefer cannula over needle.
you
Can you
prefer
hear
a cannula over a needle?
over needle? But as if I want specific areas to be done, like not too much of a volumization, only the definition of the border and all, then sometimes I use a needle because it will be more precise for me to give the cupid bow and all.
Okay, anybody else wants to comment on this? Dr. Roma, Dr. Ankur, anybody wants to comment?
I also switch between cannula. I use cannula sometimes and I do needle also sometimes. But it is depending upon which area I want to approach and how much I'm trying to volumize or fill. So if it's just basically just for hydration, then maybe just syringe injections would be fine. But if I need to really give a definition and shape, somehow I think cannulas are more better because it gives you more confidence in terms of bruising and maneuverability.
I personally feel the cannula actually also gives you less swelling post procedure. So, for a patient who has something important coming up in 48 hours, I would prefer to use a cannula and be gentle with the cannula so that we don't give them too much of swelling. And obviously, the bruising is less, there are less punctures. You're working from the cutaneous side, so it's easier for you to inject. You're not touching the mucosa per se. Dr. Pascal, would you use, you said you use needle more, but what about the question that was asked? Does the cannula break the septa and there are more chances of migration with the cannula?
It depends on the area. For the lips, this could be true. Generally, I apply just boosters with cannula on the lips, I mean. But in other areas, for example, I prefer to use cannula because you can spread the product in the areas that you want. So when you don't want to treat one specific point, but you want to treat an area, normally I prefer to use cannula. So generally for jawline, for example, but also for the jaw angle, or don't know, for the chin. Entering just in the middle and going laterally with cannula just to define the entire chin. But it depends. It depends on the patient. It depends if you have a patient that takes some kind of drugs that make his blood more fluid, for example. Generally, the rule is to use a big cannula. Big, I mean about 22G. Yes, 22G, for example, and needle for the specific points. So if you want to improve just the jaw angle, you could use the needle. And also, it's of course a faster treatment. So it depends also on the time that you have to complete the treatment for your patient.
Dr. Roma, you asked a question that whether we use with lignocaine or without. That's what you're asking?
Yes, I just want to know, in general, what is the preference of Dr. Pascal and even the others? They prefer using with or without lidocaine.
So the
And you
question,
think
Dr.
it makes
Pascal,
a
is
difference? You
do
think it
you,
makes
would
a
you,
difference in the viscosity or cohesivity of the product?
so she's asking whether adding lignocaine or lidocaine to the product, does it alter the characteristics of the filler?
No, I prefer to apply the product, the lidocaine when needed, just into the entry point. And in that occasion, I use lidocaine with adrenaline. And if you don't use lidocaine into the entry point, I don't suggest to use the lidocaine to dilute. We can say dilute the product, because if you add some kind of lidocaine into the product, you will change the rheological characteristics of the product. So you will use different product, a different product.
No, but the product does have a pre-existing lidocaine in it, does it? Or
No,
does
they
not?
don't have.
So this is without
That,
lidocaine.
yeah, so that is why I
Yes.
was asking. That's precisely what I was asking. The Skinfill ones are without the lidocaine
This
versus
is
the
an
yours.
advantage. Yes, this is, in my opinion, is an advantage. I use only fillers without lidocaine for the idea that normally when you inject, the pain is felt by the needle and not by the product normally, and that you need to inject always new areas. Yes, for sure. If you inject a big area like lips, making some kind of injection previously, then to define all the area, the lidocaine can start to work. But normally, if needed, I apply some kind of lidocaine directly into the area where I want to do just the entry point or just some kind of augmentation. So what I do for lips, for example, is to inject some kind of lidocaine inside the mucosa, but in the wet mucosa, not in the dry mucosa, and just to reduce the pain of the patient, but never use the lidocaine into the same level or into the same point where I want to inject the filler. Because if I will do that, I will change the characteristics of the filler and the features of the filler, so something can change.
Okay, what about Dr. Usha, Dr. Josna? What do you say? The product is without lidocaine. Does it make it more uncomfortable for the patient? What do you think, Dr. Josna, Dr. Usha?
I feel patients are much more comfortable when it is with lignocaine, and product also flows easily. So I prefer it with lignocaine.
Dr. Josna, what about you? You're on mute. You have to unmute yourself. Josna, you have to unmute yourself. Unmute, yeah. I don't think we can hear you.
I think with lidocaine, I think with lidocaine, mostly it is us feeling more comfortable than the patient. Uh, it's just it gives us a little more confidence that the patient will be comfortable
I
because
don't really think, Dr. Roma, I don't know if you know, if you've injected the boosters and the bioremodelers, the boosters with the lignocaine are far more comfortable than a bioremodeler without the, I'm not naming the product, but I don't know whether you felt when you inject that particular bioremodeler, the patient is a little uncomfortable. I often wonder had they mixed the lignocaine with it, the patient would be comfortable, especially when you're giving a big bolus and that the effect of the
I
product
feel
going
it's
in and yeah.
Yeah, but I personally feel, sir, it's big, meaning especially in the scenario that you're stating, the skin booster versus the bioremodeler. The bioremodeler is much more viscous than the skin booster. So that
Right.
could be one of the reasons. Personally, I don't think it's just the lidocaine that's working its wonder because lidocaine, it's in the product. So when you're injecting the product, I don't know how much of anesthesia is actually helping. It's not going to be that quick acting, and you're just going to be for maybe a minute or so before the anesthesia really kicks in. You finished your job at that particular point. So I personally feel that lidocaine doesn't really help. In fact, I prefer fillers without lidocaine because it eliminates the risk of hypersensitivity or reactions with the lidocaine.
What about Dr. Ravi and Dr. Sanchit? Dr. Ravi Kothari, your opinion on this? You prefer fillers without lidocaine? Ravi, we are there. Dr. Sanchit, if you can hear me, what's your preference?
so initially the fillers that were available before the Restylane and all the other brands that came in before the newer brands that are now in the market, they were all without lidocaine. And those when we injected, and now the ones we injecting pain point of view, I have not really seen too much of a difference because we are not going multiple injections. We are just going at one, and our entry points are very minimal. And like Dr. Minaz was saying, by the time the lidocaine actually comes into play, we have already done that site, you know.
But
So
if you're using a cannula, then you're kind of fanning all across. Then probably that lignocaine works in that case. No, it numbs that area.
And on the lip,
So
I've
that is
seen,
needed only for the entry point of the cannula.
no, specifically on the lip, I've seen that we used to inject fillers without lidocaine before, but on the lip, it has made a difference. Under eye and other areas, I agree, it may not be that painful, but on the lip, it has made a difference. The lidocaine version.
I think
Okay.
that
I would also like to add to this. Even I don't feel that absence of lidocaine makes any difference to the patient. See, most of the times the other areas of the face we use a cannula, so there's a single entry point, and cannula itself glides very smoothly, keeping the patient comfortable. So even I have always personally used fillers, or even myself or patients, without lidocaine.
Oh, that's actually wonderful news. Anyways, we go on to another question, Dr. Pascal. There's a question which says, which fillers are used in wrinkles and blemishes in type 2 skin? I don't really understand the question. He's saying which fillers are used in wrinkles and blemishes in type 2 skin. I'm not very clear about it. What does he mean? Type 2 skin, as in Fitzpatrick skin type 2? You're on mute, Dr. Pascal. You're on mute. We can't hear you, Dr. Pascal.
Yes,
You're on mute. Yeah.
sure. No, I'm mute for this problem. So anyway,
Okay.
okay. Anyway,
Horrible.
it was a little bit the idea maybe of the question was about which kind of filler could be used more superficially, and the
Yeah,
idea is of
probably.
course to use a silver one that is a really soft filler with low G prime, so less viscoses. So it's something a product. It's just a product that could help us to obtain the hydration of the area in more natural ways. So
Okay. There's another question when somebody has asked about the landmarks of the markings. I think the markings are a little confusing for everybody. So somebody's
yeah.
asked what are the landmarks of marks? If you can just repeat that. We use the Hinders line as the base, right?
Yes, as base, everything is done by the hinder lines. Anyway, when I saw this video for the first time, I saw to the company that maybe it couldn't be applied like a standardized technique because they are not standard lines. So normally, what you have to take in consideration is the hinder lines just to identify the area of the higher projection for the cheekbones to remain inside 1 centimeter from the lateral alar cartilage of the nose. And of course, other lines are made just to divide the areas. But normally, on the inner lines, you can also imagine to treat your triangle starting from the lateral canthus, going into the medium papillary line, that is a line traced by the medium papillary area to the labia commissure. And in that triangle, you can inject your products to project some kind of area of the malar area. Generally, that's the general idea. Apart of that, there was also some kind of line for the jaw line, jaw angle, marionetta lines, but they are not important in my opinion.
Okay, I just wanted to ask a practical question. It's a new product for us. So if you have to give us a reference, what product does it resemble which is already out in the market? You can take the brand names. Is it closer to Juvederm? Is it closer to Restylane range? If you have to just compare generally.
So I think it's something different. So I mean, for example, Jupiter is the entire line with lidocaine, just to start. First idea. So for sure, it's different. Apart of that, of course, you have different products that are also more able to diffuse than this product. I think that in each line, Marti, vieni un'altra cosa. In each line of other companies, there is a product that could be similar with ours. For example, silver, Skinfill silver is something that is not easy to find on market like that. Maybe the lower G prime products made by Teoxane, for example. But just to have an idea, apart of that, in my opinion, with gold, you can do whatever you want with Skinfill Gold without any kind of problem. And with diamond, you can make volume also more than the major part of the fillers on market.
So
So
gold is your workhorse. That's what you're saying. You can use it anywhere and for everything virtually.
yes, exactly. It's a filler that never make some kind of problem for you. That could be used to make small volumes, but also a good effect on lips, for example. And for diamond, is a product that could be used to make some kind of volume for cheekbones, for the jawline, the jaw angle, the chin. So it's a specific product that is also harder than the major part of plastic fillers that are on market. So more volumizing effect you will have with this product.
Okay. Any other questions? Anything? Any points of discussion before we close? Anybody from the panelists? Anybody from the
Doctor, I'm
audience?
Dr. Josna, sir. So I want to ask one question, sir. So here in this product, we have less of cross-linking and like a new technology was used. So what is the advantage compared to the other brands over here? So like in what way it
Dr.
helps us?
Pascal, there's less of cross-linking by the BDD and the DVS and more of a new technology which you mentioned. So what is the advantage the doctor wants to know?
Generally, the major part of reactivation of fillers after some year in terms of inflammation is made by BDD. So the actual trend is to use less BDD as possible. All companies are trying to do that, apart for historical brands that they are working on just on brand and nothing else, and not on technology. So the idea is to use less BDD as possible, and from Italia use less than or better has less than 0.01% of free BDD, so just to reduce the effects of the inflammation, and at the same time, some kind of small percentage of allergic reaction are made by BDDE or lidocaine. So, eliminating the major part of these allergic agents, you will have a safer product that could be used wherever you want with less size effect.
Basically, that new technology that you mentioned is basically, again, it's a method of cross-linking or there's no cross-linking?
No, it's an effect of magnetic field after the cross-linking effect. So you are not using some kind of agent that can make some problem for you if you have this product into the area or better into the field in general. So using less BDD and at the same time using products without lidocaine, in my opinion, are safer. So the coesix is just a magnetic field that allow the molecules of the hyaluronic acid to be binded by their cells. So the globulus that came out is a product, of course, with the presence of BDD, but it's stronger than a normal molecule binded just with BDD.
Thank you so much. Anybody else has any? Yeah, Dr. Padma, you wanted to ask something?
What is the longevity of these products?
The longevity, Dr. Pascal, how long does it last, the product?
On the slides were written, but now they can't help because it's something that change by patient by patient. So I mean that normally they wrote that the diamond has an effect of 1 year, more or less, between 8 and 12 months, we can say. With gold, we have an effect by 5 and 6 months, and with silver, we have an effect by 3-4 months. Just to have an idea, but it depends on the patient that you have. It depends on the area that you are treating. So just that.
Anything else? Anybody has any points of discussion?
Sir, can we use while we are doing the filler of one brand, can we use a booster of a different brand on the same patient within a short span?
Yes,
Or
if
in
you
the same
prefer.
sitting?
In the same session,
So
you can do. You can do.
yeah.
We will hope that you will start to use also from Italia boosters, but yes, you can do.
I just wanted
But
to
boosters have
ask,
not been launched yet, right?
Boosters haven't been launched. I think they've launched silver, gold, and diamond for us as of now.
Yeah.
Gold and diamond, that's right. So would it make sense to do more longer lasting products at the base and then use Promo Italia for Skinfill just to kind of top up so that we increase the longevity of the filler overall?
You're saying combining two different types of brands for as fillers. That's what you're saying.
Yes, sir. Because Dr. Pascal just said that even the diamond will last up to a year. So between 8 to 12 months.
Dr. Pascal, would you mix the two different brands of fillers together when you're doing the procedure?
I do generally. If I prefer a filler made by a company and I don't want to leave it, I start to use. But I mean, not in the same area. So generally, when I treat some patient and I love a filler made for lips, just to say something, for nose, we can say for nose, made by another company, I follow injecting that kind of fillers in that specific area and try to change for the others. At the end, maybe you will be combined to use these specific fillers also for the area that you don't want to leave.
No, doctor, if we want to increase the longevity of the filler, can we mix both the filler? That is the question. To increase the longevity of
Mixing in the syringe, you're saying, is it?
No. Yes, if this is the question, no. Of course, also when you inject different fillers in the same area, you are not able to understand if the problem, if you have a problem, could be made by one or another product. So at the beginning, especially, I suggest to be careful about that. So try to use just the product pure as it is. After that, in your house, you will be the owner. So you will be able to do whatever you want. But the idea is to not mix different products, because if you do that, you will have different kind of reaction by the patient.
Dr.
And you don't
Pascal, I
know.
just wanted to know whether you prefer using a needle or a cannula to treat the tear trough area or the under eye area,
Cannula.
or does that depend on the patient?
Generally cannula. After that, it
And
depends
why?
on
And why, if I would ask, why would you prefer using a cannula for the under eye?
because it's safer, because you can do injection deeper and more superficial when you need, and because you are able to understand in which layer you are.
Even Dr. Sanchez, the bruising would be less in the tear, prone to bruising. So if you're using a
Exactly.
cannula,
True,
it's always
Yes, you will be
comfortable.
more delicate. That's the idea.
Yeah.
I just wanted to ask, what are the chances of delayed hypersensitivity reactions with this product? Because with Vycross technology, we had a lot of cases having delayed hypersensitivity reactions.
After months, you mean after years?
Tail-mediated immunity.
Even immediately.
When we say delayed hyper, we're talking about probably after 6 weeks, we are looking at any sort of delayed hypersensitivity reactions coming in after 6 weeks to 6 months.
No, look, in my personal experience, the product is launched on market maybe since 15 years. So in my personal experience, I never had any kind of side effect. It could happen, for sure. It could happen. It's just maybe I'm just lucky about that. But I think that there is a low percentage of problems with these specific products, because are safe products. And as I said, without lidocaine, less composition in terms of BDDE is something that improves the safety of the product.
Okay, great. Any other comments from anybody? Any questions? Any discussions?
Sir, in patients whom we have already used filler with xylocane, like when we are using next session with filler without xylocane, like how much percentage of pain we can expect? Like, will it increase significantly or will it be mild, or how to convince a patient?
It depends if they forget or not the previous experience. So if they forget the previous pain, it's like a pregnancy woman. Um, you know, after the end of pregnancy, when the child is born, you will forget everything. So it's more or less the same. So if the patient forget about the previous experience, you can do whatever you want. But if the patient remember and they say, oh no, last time I didn't feel anything else, or I didn't feel anything, so this could be a problem. So generally you need to prepare, look that this time you will feel. But generally when you use a filler with lidocaine, the effect is felt later, after the injection. So the needle is felt, the product is felt, and generally the lidocaine burns a bit more than the normal filler without lidocaine.
I think
Dr.
if
Pascal,
patients, yeah, sorry. Go ahead,
do you
Sanjeev. Go ahead.
prefer using any topical anesthetic creams, especially because you prefer using fillers without any lidocaine? Do you think that helps
It can
before,
help
prior to the
just in
procedure?
term. Yes, it can help just in term of ideal pain. So it's just something that can help you to to help the patient to feel less. But the idea, but normally it doesn't help for sure. So it helps just because the patient believe that it is working. So apart for
Or it's
leaks,
more like placebo therapy, perhaps? Doesn't
yeah,
really help
just in my opinion, it works just on leaks. I will apply just on lips,
on
but
the
for
lip.
example, especially into the in Middle East, when I go to the Middle East to make my workshop or something else, they apply anesthetic cream
Yeah.
everywhere. So the idea is just it depends on your patient. If the patient believe that it works, apply the cream even into the hairs. I mean, just to leave them feeling less.
Less anxious, perhaps. Yeah. Yeah. Thank you.
Yeah.
Nothing.
Okay. Anything else? Anybody else wants to ask anything, discuss anything? Because we got to close now. There are no more questions, We must thank Dr. Pascal for a wonderful session. Thank you so much for taking time out and talking to us. We had a lot of good discussions and
Thank you.
some clarity on the new product. Hopefully, should do well. Obviously, it comes without lidocaine, as was pointed out. So maybe the cost might be a little less for us as well. So over to Mr. Prashant. It's all over to you. I'm handing it back to you.
Thank you very much, sir. And at the end, I just would like to invite Mr. Bruno to give thanks at the end. So, Mr. Bruno, over to you.
Yes, I'm here. Okay, thank you very much to everyone, to the very important doctor that has been participated to this meeting. Thank you very much, Dr. Pasquale, for the very instructive lecture. So it will be really, really very interesting. And I think and I hope that after this kind of very important, interesting workshop, now I think that this doctor can be even more convinced that they can start to work with this precious Skinfill. I remember you that Promitalia is an Italian manufacturing company headquartered in Italy that work in this field since 25 years. So it is really one of the most important player of this field. It's a company that design and manufacture the product internally with his own research and development department, with his quality control department, of course, his internal manufacturing department with the scientific department. It is something that create really a product 100% made in Italy. So we are very, very proud to bring this excellence in the world. We are also very happy to work with Beta Drugs that, as we saw in the presentation, is a very important pharmaceutical company that now is going to enter in a different field, that is the medical aesthetic field, that Promo Italia know very well because we are leader in the world. And we hope to support, to drive, and to give our experience and our knowledge to Beta Drugs, and to especially to follow and to instruct and to assist the doctor of India, because for us one of the pillar of our philosophy is education. Education for us is very, very important. Like today, for it's important for us, educate means to spread, to share our knowledge with our doctor all around the world. So also we can organize, and we hope to organize also with Beta Drugs some very important event to launch officially the product in India. But today, as I have understood, we did this web workshop with some of the most important medical aesthetic doctor in India. So it is really already we are in the good hand to start and to work in this country. So again, thank you very much to all the doctor. Thank you to Mr. Prashant for of Beta Drugs, and I hope to meet you soon in India or in some other place in the world, some congress in Dubai, in Paris, in Asia, everywhere, in India as well. It will be always my pleasure to meet you personally. Thank you very much, and see you soon. Thank you.
Thank you, Mr. Bruno. And I would like to thank our moderator, Dr. Luthra sir, and all the panelists. I would like to thank all the participants at the end, and special thanks to the doctor who has given the wonderful presentation over here. And it was really enlightening for all of us. Thanks a lot, sir.
Thank you. Bye-bye.
Bye-bye, sir. Bye-bye.
Bye-bye. Thank you very much.
Thank you so much
Thank
for
you.
having us.
Thank
Thank
you
you
very
so
much.
much.